Hi, I'm Jo Clark, and thanks so much for joining me today. This is the Redefining Midlife podcast, a podcast designed for the 40-plus woman who is determined to challenge society's myths and beliefs around midlife. It's for the woman who is inspired and ready to define midlife her way. Join me each week as I chat to health and wellness experts for up-to-date information on how to live well as some special conversations with incredible everyday women redefining what midlife can look like. Here's to making our next half of life even better than the first. Today on the podcast, we'll be talking about a topic that is rarely discussed openly, often seen as a taboo subject, yet it's a life-altering health issue that affects 1 in 3 women. We're going to be talking about pelvic floor disorders and how for many women, these issues can increase substantially during perimenopause and menopause. To help us learn more, our guest expert is Christina Machray. Christina is a highly experienced women's health physiotherapist from Embody Movement on the Sunshine Coast in Queensland. She has got a special interest in women's health physiotherapy, and she helps women who have issues with incontinence, prolapse, pelvic floor dysfunction, pre- and postnatal care. And with 2 decades of experience, extensive postgraduate training, and overseas study and practice, Christina has a wealth of knowledge in this area of women's health. Now, whether or not you suffer from pelvic floor issues now, it could very well be something that affects you later in life. In the episode, we cover how to minimize this from occurring, and as always, we learn that prevention is better than cure. Talking openly about a very common yet a very personal issue really does help to remove any shame or embarrassment. So this is definitely an episode that I encourage you to share with the other women in your life. Welcome to the podcast, Christina. And as I mentioned in the introduction, as a physiotherapist, you've got an interest and you specialize in women's health. And I'd love to know how this interest first began. So I should go backwards. Welcome. And then I'll ask you that big question.
Thank you very much for having me. I kind of fell into women's health through working while I was working in London. I tended to work in an area in musculoskeletal physiotherapy, and then just started to get women coming in post-pregnancy, which kind of then started to cross over. And then I just needed to start to find more and more about why I'm seeing these women. And I just kind of, fell into the kind of the abyss of pelvic health, basically. And just as my interest grew, you kind of find more and more and how it's related to what you're seeing in your musculoskeletal patients. And then obviously going on and having children myself and going through all of that kind of thing, you sort of get a lot more kind of interest in why is this happening to me? If it's happening to me, it must be happening to other people. And how can I help other people kind of work through these things as well? So that was sort of how it kind of snowballed from there. And it's something that I'm really passionate about. I really, really love it. Yeah. So if you asked me 20 years ago when I got into physio if I'd be working here, I probably would have said no. I was very much a sports physio. That was my that's where I was going. And but in saying that, I do get to incorporate a lot of my sports physiotherapy. I do treat athletes with pelvic health problems as well. So it gets to integrate quite nicely. So that's a beautiful thing about my profession, is that we're able to kind of work across a whole board of things like that as well. So yeah, that's how.
Is it an area that's starting to get more popular, the area of like for physios to go into, or is it still fairly niche?
I think it's still quite niche. It's getting more popular, I think, now. There's a lot more course and training available. I think since I've started there's a lot more work courses available to go and do, and people are a lot more aware of it. I think back in my training, when I was training as a physio, I don't remember being introduced to pelvic health at all. So it wasn't even really talked about within our undergraduate degree. So that's sort of one of those things, whereas now they're starting to incorporate into the undergraduate degree, so that they're aware of it, whereas no, there wasn't a huge amount of talk about it then, but now definitely more so. And it is quite a niche kind of area, but then I think in regards to this is where social media has been absolutely amazing and bringing it to the forefront and sort of putting those issues, out into the community, and people can then start to talk about it and then start to seek treatment. But really, really often I have people go, I didn't even know this existed. Like, I didn't know I could come and see you about this type of thing. Yeah.
So it really is educating people to know that this service, that there is someone that you can go to.
Yeah. And that's even within the medical community as well, GPs, nurses, all of that kind of thing. They sort of are not aware of it. So we're having to do a lot of education in that regards to sort of say, look, we can actually see, people with these issues, and we can be really, really helpful in that area. So
Mm. Oh, that's
Yeah.
fabulous. So I'm really hoping that today during our discussion that we can bring light to a lot of things that women may not be aware that they can get help for. So this is a really important topic for so many women. And even if it's not affecting them now, it's not to say that it's not going to affect them further down the track, or they'll no doubt know somebody who has
exactly that.
as well.
Yeah. I think that's the big thing of just sort of knowing, or having a conversation the other day with a patient. She's like, oh, I just decided to bring this up at my card group. And she said, as soon as I started talking about it, 3 of them said, oh, I've got those issues too.
Oh, is that right? Yeah, that's it.
Right.
Once one woman is brave enough to open up the discussion, the floodgates open. That's right. And it's something that's rarely discussed. So what I'll talk about in my research that I found preparing for this, Christina said that these disorders affect a large number of women, and one university studied, and you can tell me whether this is what you know as well, stated that 1 in 3 women will experience an issue during their lifetime. Yet for the majority of women, they often suffer in silence. And research has shown that the risk of pelvic floor issues increase substantially as women age. So is that your understanding? Like, is that what you've been? Yeah, that's 1 in 3. It's huge.
No, it's a huge amount of people, and okay, a lot of the people kind of think, oh, it's common, but it's not normal, and that's the big thing we have to differentiate. Is a lot of people experience this. Just because you are experiencing it is common, but it's not normal. So we need to kind of get that on top of our
that's such a great thing to say. That's a lot within all health areas, isn't it? Really?
Yeah, it is, isn't it?
It's common doesn't mean it's normal. So we can do something. So we'll just go right back to the start. So everyone's on an equal playing field with what we're talking about when we're meaning pelvic floor muscles. So can you just actually explain the role of the pelvic floor muscles and why they're important, particularly for women? And again, because this podcast is talking about women in their 40s and 50s. So if you can, first of all, tell us why it's important for us to have an understanding of pelvic floor muscles, and then why it's so important for women in their 40s and their 50s to be aware of it as they're going through perimenopause and menopause.
Okay, so your pelvic floor muscles are basically a group of muscles at the bottom of your pelvis. So they're not just one muscle, they're a whole series of muscles. And their job is to basically help with our continence, so maintain our bladder and bowel control, but they also help to support our pelvic organs. So they help to hold everything up within the pelvis as well. So that's the majority of their role. They also play a role in our core system as well. So we can kind of think about our diaphragm at the top being like the canister at the top. Pelvic floor sits around the bottom, and then we have our abdominal wall and our back muscles at the back. So that's our sort of canister in there. So it plays a huge part in helping to support our spine and our pelvis as well, and also our upper body and our daily functions. So everything that we do during the day, there will be an element of pelvic floor involvement. So the incontinence side of things is really important, but it's also there as an important muscle in our our day-to-day function, just of moving around the place as well. So it's really important from all ages, really, that we are aware of our pelvic floor. The beauty when we're younger is this tends to be a little bit more automated, and it's like everything else that we don't really have to think about what we're doing. It just happens. As we age, and especially with women who have gone through having children, childbirth, and that kind of thing, that can cause some trauma to the pelvic floor. So then we need to be aware of, are our muscles working correctly to help support us after all of that type of thing. As we get older, we will tend to lose a little bit of muscle mass as well. So from the age of 40, we lose about 8% of our muscle mass every decade. So unless we're actively involved in maintaining and building on that muscle mass, we're going to have a little bit of loss of muscle mass, which will then change the function of those muscles, which can then lead to obviously some bladder issues, some bowel issues going forward, with our pelvic floor.
And is that the role of estrogen plays in that as well? In the fact that does that for women the reduction in
estrogen? Yeah. So estrogen, estrogen's really, really important in every cell of our body, like from head to toe. It plays such an important role. I think a lot of times we think about estrogen as being really, due to our menstrual cycle or reproductive function, we kind of think that's where it stops, but it has a role in everything else that we do. So when we have lower estrogen, so when our estrogen starts to fluctuate as we're coming through into perimenopause, it has an impact on the blood flow into the tissues, the quality and the resilience of our collagen and the elastin within our tissues. So we can lose a little bit of resilience within our tissues, a little bit of power and strength, and then we can lose a little bit of muscle mass as well. So the estrogen is really, really important. When we're looking around sort of the pelvic area with our vulva and vagina, we can get lots of changes to the tissue within that area as well, which can also create quite a few issues in regards to the tissue becoming a little bit thinner, becoming dry, becoming irritated. When we lose that elasticity of the tissues, it just means the pelvic floor sometimes can't respond as well. Our bladder can't expand as well as what it used to, all of those kind of things. And these can have different impacts for different people as well. So some people, those changes in estrogen don't bother them at all. Other people, they can be quite significantly impacted by it. So for one person, it's not bothersome, but for some people, it can be really terrible for them as well. So we just sort of have to take each person as they come through and sort of say that this is you as a person. What impact is these changes having on you? Yeah.
And there'd be varying degrees of the impact as well. So even if they have got, say you and I have got an issue, then mine might present differently to say yours. So it's not a one size fits all. So when we're talking in this episode today, this is general information, obviously, and we'll talk about when it's time, when you suggest somebody should see a specialist like yourself. Is an issue.
Yeah.
So incontinence is actually a concern that many women have, and statistically it does increase as we age. So for women who have this problem, it might feel like you're the only one, but I also in my research found that incontinence or poor bladder control is a common condition that affects 1 in 3 women in Australia. Again, that is a huge number. So it's affecting so many people, but no one's really talking about it because it's so personal.
Yeah. And once again, it's that whole kind of thing. It is common, but it is not normal. If you are leaking, you shouldn't be. Okay. So this is the big thing. And a lot of people have gone through saying, oh, I've had a baby, and they've been told, well, you've had 3 children. That's what comes with having. What do you expect, kind of thing? And I was like, but like we can definitely do something about it as well. And I think it is quite a personal thing to talk about. Nobody wants to sort of say that they are leaking when they're having a laugh or coughing, sneezing, but there's something we can do really effectively. It can help to sort of help with that as well, which is really, really important. But so many people do suffer from it, and it's not necessarily as we get older, but also younger people do as well. So we tend to find it across the board. It does increase as we get older, and especially as we hit perimenopause and definitely into menopause. But also I do see people in their late teens, 20s as well with leaking issues.
So for women,
just got to kind of
and men, Christina, like you see, and I don't remember this when I was younger, but maybe because I wasn't looking in that part of the aisle, older women with having to get incontinence pads. So is that something, even when, say, we move from this age group, the 40s and the 50s, and women seem to get this problem when they're, decades later in life, is that still something that can be fixed with various exercises?
Yes, it definitely can. So we know with pelvic floor physiotherapy, it has an 80% success rate of curing or 80% or significantly reducing incontinence. So there is going to be an element of people that we can't resolve their incontinence issues, but physio, like women's health physio or pelvic health physio, can reduce those symptoms by up to 80%. So it's quite significant. So having that kind of right assessment and right education, and then being directed in the right way of the pathway what you need to go to, can significantly reduce your symptoms and have a major impact on your life.
Well, it would do, because a lot of people, no matter what age, if they've got an issue like that and they can't predict when it's going to happen, that would really stop them from doing lots of different social activities or sporting activities in general. So, to fix a problem like this is a really important thing to be mindful of.
It is, and I think a lot of people I have people that will go, well, I can't go out today because I don't know where the toilets are, or I can't, I've got to go for a 2-hour drive. I don't think I can handle that 2-hour drive. And so it has a huge impact on their social life as well, but their emotional well-being and all of that. So that then stems into a whole lot of other issues that they can develop as well. So this is where I get a lot of joy in my job, is because we can help with that. So then they can get their life back, or they might be restricted in I would really love to go for a half-hour walk, but I can't actually make it, be down 2 blocks without having to need to go, or feeling like I need to go to the toilet. And so that's restricting their exercise, and that can have a little bit of an impact on other health issues in regards to weight, all of those kind of things. So that all of that kind of stuff tends to snowball as well. So
Yeah, there's a
It's
huge
quite
ripple effect with it.
Yeah, it is. It's massive. And so I think just kind of hearing people's story and just trying to kind of unpack that and sort of see how it's impacting their lives.
Yeah.
And then they kind of go, I didn't realize it was having such a big impact, but they said, oh, now I see how all of these things are related. And then we can slowly start to kind of build that back up together again. So that's where I get a lot of joy. This is why I do my job, because
yes.
yeah.
No. And it'd be, the women, I imagine, would be so grateful and thankful that they took that step and found someone like yourself to help.
Yeah.
Especially if it's got such a high success rate.
Yeah.
Can you tell me about the different types of incontinence? Because I didn't realize there was until I started looking into it. There are different types of incontinence and how they relate to the changes in our bodies. So if you can just try to, help me with that one and help the ladies with that one as well.
Okay, so when we're looking at incontinence, we have what we call stress urinary incontinence. So this is basically the incontinence we get when we cough and we sneeze, or we laugh, or we run, or we jump, or things like that. So that's generally kind of that leaking through into there. We can also get what we call urge incontinence. So this is the urge incontinence, is where we kind of have that feeling we're going, and we're like, all of a sudden, oh God, I need to go to the toilet. And it goes from 0 to 10 very, very quickly. And if you don't go, you feel like you're going to wet your pants or something through into there. So those are the two, to be very basic, the two different types that we have through in here. So the urge incontinence is the one of the things, oh, I'm getting to the garage. Oh gosh, I need to go to the toilet. Stick the key in the front door. I need to go to the toilet. Here, tap running. Yeah, so that's that urgency type of thing. So we get this very, very strong urge. The stress incontinence tends to be, I say, more activity based. So it's like when you're performing an activity of coughing, sneezing, and that. So people can have one or the other, or they can have a mixture of both as well.
Gotcha.
Yeah. So, and the mixture of both is called mixed urinary incontinence. So we'll have an element of stress, and then there'll be an element of the urgency that comes through into that.
Yeah. So obviously it's a very complex area as well. It's not just.
Yeah, it is. Yeah.
Everyone will present differently.
Exactly that. And then we go into stress incontinence, and there's different types of stress incontinence as well. So, but just to keep it very basic, that's the sort of two types that we're dealing with through into there.
And is there an increase with that as women start to go through those hormonal shifts again? Is that what?
Yeah. So we do find that. So a lot of it comes down to those hormonal shifts and the changes to the integrity of the tissue. So quite often with the urgency side of things, so we can get an increase in frequency of going to the toilet, an increase of going to the toilet at night time. We feel like we're not emptying well, all of those kind of things. They tend to be sometimes a bit more hormonally driven, so changes to the tissue. So the lack of, with the dryness and the thinness of the tissue, losing a little bit of elasticity within the bladder, so the bladder capacity comes down through into there. Also, the pelvic floor muscles are just not responding as well as what they used to, because they have lost a little bit of bulk, or they're feeling a little bit dry and irritated as well. So that can change through into there. The stress incontinence, once again, a little bit to do with the power of the muscles as well. So being able to kind of squeeze and contract quickly, so we can avoid those pressures that are created when we do cough and sneeze. The other thing is, as we get older, we tend to have a little bit more weight gain as well, and especially for women going through the midlife, around the middle area as well. So incontinence is really all about pressures above and pressures below. So if we have more pressure above, it means we've got to generate more pressure below to be able to manage that. So that kind of abdominal weight gain can also have an impact on that. Yeah. And we know definitely, just with treating stress incontinence, we have the biggest result of people, along with pelvic floor exercise, but the biggest predictor of improvement is actually sometimes a 5% loss in weight. So if we can people to lose 5% of their body weight, their stress incontinence will improve quite significantly. Once again, just really basic physics: pressures above, pressures below.
So what can a woman do who's listening to this and goes, well, it's not severe, but they have noticed a change? What sort of things can they start to do just to maintain the integrity of that whole pelvic floor area?
So a lot of it is just general movement. I think that's the biggest thing, is keep yourself moving. Motion is lotion, basically, because if we're moving, our pelvic floor is going to be involved at some perspective as well. Doing some resistance type weight training as well, because we just want to have that bulk within the muscle and have the tissue, like the muscles around the area. We're talking about our abdominal wall, our legs, our glutes, all of that strong as well. And then we can also be doing our isolated pelvic floor muscle exercises to incorporate with that as well. So everybody, and I put myself up and say I probably don't do this every single day. I should be, but we should be doing pelvic floor exercises every day.
And
Yeah,
what might they be? What does that look like for someone like I'm going, I don't know what that means.
So basically, people might know pelvic floor exercises, Kegels as well. So Kegel is the doctor that kind of discovered the pelvic floor and found out what it actually did. So that's where the name comes from. So when we're looking at our pelvic floor, it has a job of squeezing and lifting. So constricting to kind of help with our continence and lifting up. Mm-hmm. So when we get people to do a pelvic floor exercise, what we want them to imagine is trying to squeeze around their back passage, like they're trying to stop themselves passing wind and drawing up and in. Okay. And then we need to let that go. So when we're doing our pelvic floor, the contraction's really, really important, but also the letting go side of things is really, really important as well. So we can get a good, smooth contraction going through. So some people go, right, I'm going to squeeze, and they keep on squeezing, but they forget the let go side of things as well. So the squeezing is really, really important.
Yeah.
And we like to incorporate that with our breath a little bit as well, just so we can help to balance those pressures. So normally what we do is get people to take a nice deep breath in. As they're breathing out, we're going to squeeze and lift our back pelvic floor by squeezing around that back passage and lifting it up and in. And then as we breathe in again, we let it relax down.
Gotcha. Okay.
Yeah. So I just
I was doing that. Lucky we don't have vision here. I was trying to do that one.
And it is quite a hard thing.
That's a great thing, isn't it? You can do these exercises and no one will know that you're doing them.
No, you don't do it. And a lot of things we're trying not to overuse our leg muscles, our abdominal muscles around in that area and trying to get it going as well. So as I say, I have a lot of people come in and see me and they're like, oh, I can do my pelvic floor. May check to see how they're doing it. And well, actually, no, we need to get that working a little bit better. And the hard thing with pelvic floor exercise is sometimes as well, some people have a pelvic floor that can be a little bit weaker, but some people can have one that's overworking as well. So,
and what does that look?
Too much.
How does that present? Like,
they can present very, very similarly. Okay, so we can have people who have got an overactive pelvic floor that's present with leaking frequency, coughing and sneezing, going to the toilet more frequently. So this is where it's quite important to see a pelvic health physio, because then we can distinguish, do we need to get you doing pelvic floor exercises, or do we need to change the way that your pelvic floor is working?
Yes.
So this is where that's really, really important. So some people, as I say, they start doing pelvic floor exercises, can actually make their symptoms worse as well. So so we've got to kind of, that's where
somebody.
Yeah, that's why you need to see somebody. So I'm having a lot of people always kind of associate, I'm leaking with my pelvic floor must be weak. That's the normal linkage that we have there. But quite often we'll see that they've actually got too much activity going on their pelvic floor. It's working a little bit too hard and losing its function in the other way. So, yeah.
So what sort of repetition do you, and the frequency, what do you suggest for women to do?
Well, what we want to try and do is we want to kind of work on the endurance side of the pelvic floor. So can we squeeze and hold and let go? So normally what we try and aim to do, and this is very, very general, is we try and work up to getting people to be able to do 10 lots of 10-second endurance holds. So squeeze and lift, hold, count to 10, let go. And try and do that 10 times in a row. Yeah. What you might find as you're doing that, as you go along and you go, I'm holding really well for like 2 seconds, but then all of a sudden I feel things kind of disappear or melt away. And that just shows just the level of where your pelvic floor is at the moment. So we don't try and hold for 10 seconds there, because the muscle just doesn't have that capacity to do that. But we want to try and build up to being able to do that. Yeah. So that's also where it's quite beneficial to come and have an assessment, because then we can say, right, this is where you are. I'm not going to get you trying to do 10 lots of 10 seconds because you don't have that capacity at the moment, but we're going to work really hard. And that's our end goal of being able to do that.
Is that once a day, twice a day? Like how often would you do
something? So at least once a day. That's sort of a maintenance kind of thing. We aim to try and do 3 times a day, just to try and help to build up. So if we're trying to build up some strength and some function within the pelvic floor, we want to try and do 3 times a day. Yeah. So it's one of those hard things, because we do need to take time to do it. As we can't just sort of do it while we're doing other things. We sort of need to take that time. Yeah. And to say that's quite hard to remember as well, because we're not physically seeing it happening.
No, that's it. And you mentioned earlier on in as we started to talk, that, you know, we're looking at also the pelvic floor with the bladder control and also with bowel. So is it the same? Do the Kegels help with women who might have issues like bowel issues as well? Is that something?
Yes, yeah. So as I say, our superficial muscles of our pelvic floor. So we've got what we call our external anal sphincter, which is around our back passage, which is basically like our bum hole, and that's the one that helps to constrict and keep everything through into there. So when that relaxes, that's how we empty our bowel, and that's part of our superficial pelvic floor. So when we're doing the squeezing, that's what we're trying to do, get that constriction happening, and then we'll get the lift coming up through into there. So that will definitely help with that. So that's why we tend to use that cue of trying to stop yourself passing wind, because when you do that, automatically what do? You feel like you're squeezing up around that back passage area.
Okay. And other issues that a lot of women will have are the various types of prolapses as well, and you can see just the trauma that can sometimes happen to that area from childbirth and then at consecutive births afterwards. So can you just walk through some of the different issues that women might experience, and if they start to notice changes, what could those changes, or how do those changes present, basically? Because if you put up with something for so long, you may not realize that, again, it's not normal, because it's just part of what your body has felt like since you've had kids. So, but maybe it should be like that. So
so some people can experience prolapse after having children. Quite often that tends to be when the damage to the connective tissue is actually done, but they might not be symptomatic until they get as they age or get older as well. So sometimes we can be, just because of our like estrogen levels, having that huge abundance of estrogen in our childbearing years, generally condition wise we're a bit stronger, we're moving around a little bit more, all of those kind of things tend to hold on. Then as we start to go through those changes, and it's like the changes we talked about with your bladder going on with your pelvic health in regards to changes in your incontinence and things like that, we start to lose a little bit of the integrity of the elastin within the tissue, and the collagen loses a bit of resilience. Like everywhere else in our body, as we get older, things start to head south, and that's basically what
they do. Yes,
they do. They sort of kind of start to drift downwards, and that's all that's happening with your prolapse. So prolapse basically means descent, coming down. So it just means these pelvic organs are moving downwards. So people quite often complain sometimes of a feeling of heaviness within the vagina, dragging within the vagina, or they might be aware of a bulge within the vagina as well. So when we're looking at prolapse, it can be coming from your bladder. So your bladder actually falls back in towards the vagina. Your uterus or womb can drop down into the vagina, or then we can get a little bit of movement of your rectum falling forwards into the vagina. So it can be one of all those, or a combination of those things as well. And obviously in order to assess what's driving the heaviness, we need to do an assessment with that as well. So with those things, people can present with symptoms of leaking, inability to empty their bladder well, problems emptying their bowel, just a general feeling of heaviness, that they go, I go for a walk and I get 500 meters down the road and it feels achy and heavy, or I don't feel like I can do what I would normally do, or I'm aware of a bulge coming out of my vagina, and it's just really uncomfortable when I'm sitting, all of that kind of thing. So as I say, we tend to find that these issues do tend to get worse the older we get, once again, because we lose a little bit of strength through our musculature and just those changes within our connective tissue coming through.
So it really is to make sure that we're on top of this pelvic floor health from a young age, really, isn't it? Not just wait until a problem presents. So if someone has noticed a change, can they, like with having the Kegel exercises for the urinary incontinence, is there something that is fairly simple that people can do just to maintain, again, the integrity of that area, to make sure everything's sitting up where it should be?
Well, I think also, so we talk about looking after our bowel health. So I talk about bowels and making sure that we have a nice kind of bowel routine. So avoiding constipation, avoiding straining at all costs. The bowels have the biggest impact on our bladder function as well. So when we talk to people who come in and go, oh gosh, I feel like I'm going to the toilet all the time, I'm a bit irritated. What's happening with your bowels? Oh, I haven't been, I go once a week. Or I found that I used to go every day, but now I'm going, every second day or every third day. and my stool's quite hard, or I'm really struggling to empty, I'm having to strain a bit with that. So we really focus on that bowel health. So from a bowel health perspective, what we want to make sure is people are taking adequate fluid intake. That's really important. We're getting enough fiber in our diet as well.
Yeah.
And also we're moving. The bowels love movement.
Yeah.
They're a little bit of a funny thing. They're a little bit of creatures of habit. They like to go to the same toilet at the same time each day. So we tend to find if you're out of routine in regards to staying away somewhere, that's when we can have a little bit of issue. So it's being a bit proactive. If you know that you're, every morning at 6 a.m., that's your usual routine, then keeping on top of that, what can we do to help with that? If you know that you're going to be traveling more, or that you've had an MP, go, gosh, I feel a bit dehydrated, I need to get my fluid intake up, or my diet hasn't been so great, then that's what we kind of focus on.
Okay.
Also kind of getting into the right position to be able to empty your bowels on the toilet as well. So I know we've heard people talk a lot about squatty potties and things like that.
Yeah.
We tend to use those quite a lot, just so we can get the pelvic floor into a nice relaxed position and the bowel into a good position to be able to empty pretty easy through into that. So we talk a lot about just kind of that bowel habit routine. It's really, really important. Yeah. So that's probably the one thing that we do harp on, and I talk about this from young people all the way through to the end, is just that's our first question: how's your bowels? And it has such a huge impact on that kind of. Yeah.
So what about with the uterus dropping down? Like, what's the what do you do there? Is it Kegels? Is it just that will help keep everything?
So,
and again, it's going to be women who have had well beyond. Then again, need much more. I don't know what the word to use. Like more intervention.
Yeah. So we can. So if they do have a prolapse, we physically can't change the anatomy as such. So once we do have a prolapse, we can't change the tissue in that regards, but we can help with the symptom management and things like that as well. So what we kind of look at with prolapse is there's the physiological, the anatomical changes that happen within the organs, but also what symptoms are people experiencing, how bothersome it is for them. So if they're experiencing incontinence issues or heaviness and drag, how can we impact that? So with that, we can look at doing pelvic floor exercises, or we can look at the way that they're lifting and moving things, like how are they breathing, how strong are their legs, like have they got adequate strength in their legs and their glutes, and that if they're squatting down to pick things up, or are they really struggling with the strength there, which then creating a lot of extra pressure through into the pelvic floor. So there's lots of symptomatic relief that we can do as physios. Some physios are also able to fit pessaries as well, which is sort of supportive devices to help basically hold up the prolapse and within the vagina as well. So we do have some physios who can do that. You can also get that done through your gynecologist, and that basically just helps. It's like a splint, helps to lift everything up on and off the pelvic floor, and helps to support everything in there. And they can make a world of difference. And then that can make it a lot easier to get our pelvic floor muscles strengthening, and people can carry on with their day-to-day lives. Yeah.
So what would a woman do who might have a more serious condition with regards to prolapse, whether it be bladder, bowel, or uterine?
Yeah.
And they've done all the exercises. Is the next step for some women who they've improved it, but they're needing more help? Is it surgery? Is that usually the next step?
Yeah, so it really depends on the person. So we'll have a good chat to them, sort of see how it's going. So they might come through and we'll try some conservative management, which regards like these lifestyle changes that we're talking about. So our lifting management, our weight management, getting our bladder and bowel health working well. Some might choose to trial a pessary and see if that works well for them, and that can work really well. And the next stage, if it's still bothersome, is going down that surgical route as well. Yeah, so that's when I go see a gynecologist, and that's through into there. So
do women's health physiotherapists work in conjunction with gynecologists or a GP practice at all? So is that what you normally do?
Yes, we do. Yeah, so we do try and get that education out to GPs about what we can do from our point of view in regards to prolapse and incontinence and things like that. So we do work with a lot of GPs, and also we do work with the gynecologist as well. So quite often if the person's kind of gone straight to the gynecologist, they might refer back to the physio to try this conservative management, or we might see them pre or post operatively also. So we do have a lot to do. So it plays an important role in the patient management of these conditions as well. So quite often we'll be seen by a gynecologist and a physio at the same time. So we do have those relationships through into there, because there's two areas that are really, really important. As I say, even if you have had surgery, we still need to go that kind of fix the physiological anatomy problem, but we've still got the underlying thing sitting there that we need to address. So it's the whole part of the picture.
Christina, we mentioned the loss of estrogen has a big impact on a woman's body as well. So is that something you've found if they have estrogen put in through, again, supplemented by hormonal replacement therapies, does that make a difference if they do that in conjunction with the exercises and things that are provided for them?
Yes, definitely. So we do talk about using, especially, I'll focus a little bit more on the sort of vaginal health, using a topical estrogen cream can have a huge, huge impact in these areas. So we're talking about, obviously, especially in regards to urinary frequency, that those urgency type of symptoms, and that kind of thing as well. So that has been, and also with the sexual function. So quite a lot of women, when they're going through this midlife, will start to develop sort of pain with intercourse, and it become quite uncomfortable. And this is quite often due just to the changes in the tissue in regards to the lack of moisture through into there, getting a little bit more drier, a little bit more sensitive and fragile as well. So we can definitely find that topical estrogen cream can really, really help with that, to make that a little bit more comfortable. I also recommend as well with women with that using a vaginal moisturizer as well, and that can definitely help just ease some of those dryness and irritation type symptoms as you're going through. So that those topical estrogen can be really, really helpful if it's appropriate for the women to be able to use those at the time. But we do recommend that quite a lot through, and we have to go obviously in conjunction with the GP and discussing that.
Yes. Because that's a big area, isn't it? The sexual health that can be affected during this stage of life, women who experience those sorts of things. And for many women, they don't realise that there can be an easier fix for it, that they don't have to, again, suffer. Like, don't have to suffer through certain things. So it's important that women know that but you don't know what you don't know.
Well, exactly
that's why podcasts and social media and what you're doing and talking at events and things is so important.
Yeah, and I think the biggest is we can have obviously those tissue changes that happen, but also those loss of libido and that. And we know that's quite often related to just the changes in testosterone. So women do produce testosterone. It's a really important hormone within our cycle as well, and that can reduce that libido. And we know just by doing some resistance training that can help with the free-flowing testosterone within the system. So this is where the exercise component becomes really, really important. And that's something we can do really naturally to help sort of boost one our strength, but also to help with our mood and our, that sexual function as well. So it's really, 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 really important. Yeah.
And do you discuss that with your patients? Because I know, the term when you were talking about how the vaginal changes and so forth, that it's the most horrific name I remember coming across a couple of years ago, vaginal atrophy. And it's awful. The most disgusting sort of term.
It is. I always kind of think about it. It's awful. They've actually changed the term now, so it's known
thank God.
as it's just an awful. I always tend to find that a lot of the terms that they use for the female issues are always just so, I don't know, grotesque is not the right word, but just not really nice. So what they've changed it down to is genital urinary syndromes and menopause. So that's the GSM, which still sounds quite not so great, but that's what it's been changed to. It is a mouthful. Okay. So I just say GSM all the time because I just get tongue tied. But it still just doesn't sound like a nice term. Everything's like atrophied or prolapse has this very negative connotations to it as well. And I think it's a big thing I say to women. It's like, don't be scared of prolapse. There's lots of things, like it can be quite kind of fear mongering and that kind of thing. But there's lots we can do to help with that as well. So it's the same with that. Like you told you you're atrophying and you're just like, oh gosh, I'm wasting away something. Yeah, I'm losing something.
Like geriatric eggs, it's all geriatric.
I know that happened with me, and I was just like, oh, you're because you're over 35, you're really like geriatric, and I was just like, gosh, I don't feel that old, but anyway,
whatever. Another thing we've touched on a couple of times, but I really want to nail this because it's huge that this is it's such a private part of a woman's body, isn't it? And it's something that if there is an issue, that there might be some sort of shame around it, and then you don't want to be singled out, but you don't want to be talking to people about the issue. I mean, it's the emotional health for a woman who might be having some sort of pelvic health issues would be huge. So how can women start to manage the stress and emotions to support these changes? Like, is that something that you do as well with the women if you them?
Yeah, I think a lot of it comes down to education and just that knowledge, and also knowing that you're not alone. Like, this is, as I say, it's quite common, but it's not normal. So once I used to say, look, I've seen so many people today with some of that. Oh, really? And like, I was like, if you go and have a chat to your mum or your sisters or your girlfriends, like, ask the question, and you'll probably find that most of them have had some kind of, issue, or something going on, and that then they're kind of like, oh, so I'm not so different, I'm not alone. I think
Yeah.
that's the whole kind of thing. It's just that fear that's almost taken in, where it's like, oh, this is happening to me, but I don't know why. And if you have an understanding of why it's happening, and what we can, and knowing that there's something really positive that we can do about it, that takes a lot of that fear away. So my job, I find, was it's trying to empower women as well, just to say, don't let this rule your life. You are going to be able to live your life to the fullest, and we want to make this a minimal part how you're living your life. So we want to give you the tools that you can manage this moving forward, and you know what to do, and you have that, you can get on and do what you want to do. It's really, yeah, that's my biggest thing. It's just getting people so that they're not restricted by their bladder health or their bowel health or anything like that. It's sort of saying, right, I want to go and climb the mountain. Right, I'm going to go and climb the mountain. This isn't how I'm going to do it. Yeah, and that's not going to be sitting in the back of your mind all the time. So yeah, we do deal with a lot of that kind of thing. It sort of becomes a little bit more. So we deal with the whole person. So we're not just looking at their pelvis, it's that whole person and how it is affected, because it just has such a huge impact on everybody. Yeah.
Oh, I can imagine it'd be massive for some women. And for some women, it might be their first time that if they go to a physiotherapist like yourself, it might be the first time they've actually spoken out loud their issues with another person. So it would be a fairly big, long, arduous journey for some women, I would imagine.
Yeah. I think the hardest bit, as I say to a lot of women, the fact that you've actually come through and see sort treatment is a big tick of just saying, right, actually you've made a really big first big step there, because that's always quite hard. I'm always, as I say, from me, if people have got questions and they're not quite sure, I'm always really happy to have a quick chat to people if they've got issues that I want to talk about, because sometimes I'm not quite sure, I don't want to make an appointment, so I'm quite happy to have a quick chat with them and sort of say, look, what's going on? Do you think it's worth, is it worthwhile me coming and seeing you? And then we sort of go through and explain what we kind of have through a women's health consult as well, because that can also be quite a daunting task of going, oh God, what does that entail as well? So that can be a big thing. In my practice where I work, we will generally send out an email to somebody with a questionnaire in there, which has got lots of questions about their bladder and bowel health, partly with a little bit of proviso on the outside of, are these some of the symptoms you're experiencing? You just get some thinking about what's happening. And then they're going, oh, I didn't realize that was an issue, but now I'm seeing it written down there. There's something, but also gives them a bit of an idea of what we will be discussing when I come into the consult as well. So it's not sort of kind of a big shock and horror, kind of thing coming through. I always sort of say to women as well, is like, this is a very kind of open, unjudgmental space. There's nothing, feel free to tell me as much as you feel happy with as well, because I know it's a lot of personal information and it can be quite delicate as well. So as I say, but it's a very, very safe space that you're chatting within there. And I was like, I've heard a lot, there's never too much information from my behalf. So the more information you can give me, the more more ability I have to be able to help you going through that kind of thing. So and some people sort of start off a little bit gingerly, and then they kind of, and once they see the links between things, like, oh, this is why that makes so much sense now. And then they go, oh, is this why I've also been experiencing this? And I'm like, right. And they can start to put a bit of a picture together. And that's where they kind of get a little bit of that empowerment, because then they start to realize, oh, I do have some control over this. I know where I can help myself as well.
So Christina, what are some of the key signs that a woman might look for, just to see if she is at that stage where she might see a physiotherapist who specializes in women's health? Can you tell me what they might be?
So any issues with your bladder and bowel health that that you've obviously, there's nothing sinister going on. So we know we've had leaking. Leaking is very common, but not normal. No woman should be leaking. So that's definitely
that's a red flag.
Yeah. So heaviness or draining within the vagina, or feeling that bulge as well. So that's signs of prolapse coming through. Just that your day-to-day routine, so it's having an impact. So I can't exercise away. So I really love to be able to run, but literally I can't run 500 meters down the road without having to wear a pad or feeling like I'm leaking through my, my activewear, all of that type of thing as well. Any pain or discomfort within the pelvis, like the vulvar region or vagina region within the pelvis, or into low back pain as well. It's quite often associated with pelvic floor dysfunction through into there. But as I say, definitely changes within that bladder and bowel. Feeling of like you've got a UTI, but not got a UTI as well. So that bladder infection. So that's quite a common sign. People are like, I just feel like I've got, my bladder's irritated all the time, but I don't have an infection going on. Yeah. And that's sort of those things is where we can help out with. Yeah.
And where would a woman find somebody who's a physiotherapist like yourself who specializes in this area?
So generally, as I say, probably the easiest way to go is to get onto good old Google and just put women's health or pelvic health physiotherapist within your area, and they should generally come up with that. Not all physio clinics will have a woman who has a special interest or specializes in pelvic health. So you'll have to either go through, but normally that will filter out because most clinics will advertise if they've got people working within that area as well, and generally they'll have a good sort of rundown of the people within the clinic and look at what they're treating and those kind of issues through into there. And once again, if you have any questions, I will call the clinic and get them, if you're able to speak to either the admin staff or if you want to talk to one of the physios who's dealing with it, just to make sure that you're heading in the right direction so they can guide you along in that pathway and give you a lot of information that way. Yeah.
Well, it's been so valuable to be able to talk to somebody in this area because, again, like I said, it's not a topic that a lot of women talk about or know about. So I hope that just our discussion today has helped somebody to take a step towards helping that whole area if there is an issue, and if not, start some of the preventative things that we've talked about today.
No, there's lots that we can do, and we're always here to help. And as I say, this is a constant kind of journey going forward. As I say, it's one of those things that, at different stages, it might not be affecting you now, but what we can do is be a bit proactive and going, right, I don't have an issue now, but how can I stop that being an issue when I'm in my 50s and that kind of thing? So further down the track. So I always kind of think knowledge is power, and just knowing what you can do to help with stuff. And there's lots of simple things that we can do and just integrate into our lifestyle that can make that journey, a lot more pleasant. And it shouldn't have to be hard and difficult as well. But if we do come into problems, there's lots of things that we can do to help with that as well.
Oh, thanks so much for all of that information. It's so important. Yeah. Now, to wrap up the podcast, so I've just got a couple of little questions to ask. What are you enjoying mostly about this stage of life that you're in now?
I think being a bit more aware of myself and being happy within my own self. I think being in your 40s, I've kind of come to accept myself a lot more. I think it's your 30s is kind of your big learning journey, and then you get to your 40s and go, actually, I feel a lot more secure in myself. And so if you don't put up with as much, but you're kind of more happy in your own skin, I think. Yeah.
Oh, totally agree.
Just kind of feeling a bit more in your own skin instead of just knowing where you kind of want to be, but also having those goals to kind of move through. But it's like you've kind of gone through that massive learning curve and finding out about yourself. It's been a big quite enlightening.
There is a lot of life left to live. So what are you looking forward to in the future?
I think, as I say, watching my son grow up, I think that's probably one of the most important things to interview, and just for seeing where I go career-wise. I think I would have never, say 20 years ago when I got into physiotherapy, I would have not ever thought I'd be working in pelvic health. And so it's just sort of seeing how that morphs into things. I think it's opened my eyes up to a lot of other areas of helping within the community as well. I think that's a big part. I'm very passionate about people having access to all this information. I feel a hard thing in healthcare at the moment is it's quite often reliant on money and financial position to be able to afford care. And my big thing is being able to get that care out to people who, for everybody, it should be available for everyone at every level. So that's sort of where I'm kind of sort of looking towards from a career perspective, but just enjoying life and being, with my son and watching him grow, which has given me a lot of joy at the moment. A lot of challenges, but a lot of joy.
Oh, that's lovely. Now I've got my final wrap-up question that I always ask my guests is that if you could look into the future, what do you hope 80-year-old Christina will say about current day Christina?
I'd hope she'd say that she's lived her life to the fullest and surrounded herself with people that she loves, but also love her. Because I think having those good relationships and being surrounded by beautiful people is just the most important thing in life for me at the moment anyway. So I hope that I still feel the same when I'm 80 years old.
Oh, well, I hope so too, Christina. It's a beautiful way to end our podcast interview today. Thank you so much for your time. And I hope that our discussion today is going to help some women who are listening either today or into the future, and it'll change how they're feeling and how their pelvic health is going to be looking in the years to come.
Thank you so much for having me. I've really enjoyed it. It's been great.
Terrific. Thanks very much.
Yeah.
Thanks so much for listening and sharing your time with me today. I'd love you to hit subscribe on Apple Podcast or your favourite podcast app and leave a 5-star rating and review. To keep spreading these empowering messages, please share this podcast with other incredible midlife women in your world. Join me again next week for another redefining midlife conversation. Thanks again for tuning in.